write notes, but here I should not miss out a point because it's a very emotional moment for all of us. So let me begin with a simple truth. Women's health care has always been underestimated for a very, very long time. And today, we are changing that narrative. In just 2 years, we have performed 500 robotic gynecological surgeries. Now, this is just not a number to impress any one of y'all or the press or anybody. What we meant is, we meant to challenge the system, we meant to challenge the disease, we meant to challenge the outcomes that we have given. Because these were just not routine cases. These were very complex cases that we have done. It's not like simple hysterectomies. 500 most complex cases which were reoperated, where people were told you cannot operate on them, you have to live with this disease, just take painkillers for the rest of your life till your period stops. Something like this. And they are deep infiltrating endometriosis, fibroids as large as 5 kgs, multiple previous surgeries, very high-risk patients like cardiology patients and all, where they were told you cannot have a surgery. You have patients with very low ejection fraction as well. So cases many believed were too difficult, including the patient herself, and she believes she's going to live with this disease. So cases many women were told, go ahead, live with it. We refuse to accept that. With robotic surgery, we brought precision where there was uncertainty. We brought hope when there was fear. And we brought outcomes when there was limitations. Limitations meaning limitations in conventional open surgeries, where robotic gave a beautiful precision, safety, better recovery and outcomes, and complete clearance of the disease, which is the most important thing, so that they do not have to suffer, and the life-term care. Today I stand here not only as the first female gynecologist in Tamil Nadu to have finished it so fast, 500 cases in 2 years and few months, but this is bigger than me. This is bigger than this program is bigger than the hospital, my team or me. This is about improving that India is not following global standards anymore. We are actually setting our own standards and putting India in the global market. So this is about not providing just Chennai and Tamil Nadu to be, the hubs for surgery. This is creating center of excellence. So let me say something even more important. Volumes, that is the volumes that we said 500 of robotic surgeries in 2 years and few months. Volumes means nothing without the outcomes we've given. So these are 500 surgeries, successful surgeries. That is what is more important. So every single surgery we perform is driven by one goal and one only goal: better recovery, quicker return to normal life, painless, bloodless field, and a long-term cure. Because behind every statistics, this is a statistics for the rest of the world. For me, it is behind every number, behind every one of the 500 was a woman who wanted to get back her life and get back to her normalcy and do things just like the rest of us. So that is what actually truly mattered to us as a team and to our institution. And another mission which is very close to my heart is, this kind of expertise cannot lie with only one team or few teams. It has to be prevalent everywhere. We must multiply excellence. And how do we do it? That's why we've taken up the responsibility of training very many doctors across India and across the globe in our institute without costing a single rupee to those doctors. We are giving this training just for free. Because the future of healthcare doesn't just depend on few experts. If we want India to lead globally, we must keep knowledge not exclusive only to ourselves. We have to expand it. To every woman listening today, I'd like to tell you, you do not have to accept suffering as normal. Please don't do that. You do not have to delay your treatment because you have to be bedridden or you have to take rest for a long time, which conventional surgeries actually did. Your recovery was very, very slow, and we must, not settle for something very less. World-class care is here. advanced technology is here and expertise is here, right here in our city, Chennai. And the healthcare community, we have to take up this and evolve and adapt. So 500 surgeries is not a milestone, it's a message that 500 complex gynecological cases with women's health problems have been solved. We are not just doing robotic surgery right here. What we are doing is, we are redefining the outcomes of surgery in gynecology itself. India is no longer catching up. We are actually setting rules and benchmarks. So women deserve precision and better outcomes. The future of gynecology definitely is robotic surgery, and we believe with the 500 complex gynecology cases and much more, thousands, more than 10,000, 20,000 surgeries we've done, our team, in our entire practice here in Chennai. So, coming over to many people asking, this is enormous number, how did you achieve it in 2 years? Yes, it is because the need is there. It always, when the need is there, definitely technology follows with it. And we are often underestimate the need of these patients. These are not just routine cases that you have seen. These are women who suffer years together. Sometimes endometriosis takes 7 to 10 years even to diagnose it. And we're told, it's just painful periods. Deal with it, take these tablets, you will be all right. So these are failed treatments. These are multiple consultations. They have wandered from one hospital to the other, from cities, even from different countries. They have come here for a treatment, and these patients have been told, there's nothing more that we can do for you. When we combine robotic technology and a focused surgical program, so technology alone is not important. You have to have a focused program and a consistent outcome. Volume becomes just a byproduct of the trust that these patients have given to us. So, what people, now everybody sitting in the press, the question is, what is it so different from what the other surgeons have accomplished? Two things. One is the complexity of the cases we have dealt with and the consistency. When you do one surgery very beautifully, it is called skill. But when you're repeatedly giving that outcome, that means we have put the system in place. There was discipline in what we've done. We've adapted to a technology which can redefine healthcare and surgical outcomes and the vision behind it, and giving back to the patients their dignity and their life. So, is this only for the elite? This is a common question asked by press and everybody else and patients. We've treated even our healthcare assistants here, our housekeeping women, who believed in us when they went to the ward and saw that the patients were walking, whereas previously, few years back, they were discharged after 2-3 days. Now they're discharging in the same day. That lady believed in me and came. She said, ma'am, I have some money and I know hospital will support me. Can you do robotic surgery for me? And she got back to work in just 2 to 3 days, doing her routine housekeeping job. So this is, what is accessibility? What about the accessibility of this patient? Is it only for the elite, the people who have money? No. You have to understand one thing. Robotic surgery is an investment in better outcomes. So less complications, faster recovery, shorter hospital stay. When you look at the total cost of the illness, the total cost is just not the surgery. It is recovery included. It becomes very efficient than the prolonged recovery, which is very common in traditional surgeries or even laparoscopic surgeries. Our goal is to make it more accessible. With these 500, what we have learned is, starting from the first case, we have evolved. We've made it more accessible to patients of all class, number one. We've made the costing very effective so that many women are benefited from this, and more availability and more knowledge sharing. And that is why training more doctors is the most crucial. You have to understand that our CM has installed this system even in Omamdura Government Hospital. So it is accessible for all class of patients, right from corporate hospital to government hospital. He believed in technology. Chennai, Tamil Nadu has always been in the front to adapt to technologies and implement it in our state. The biggest challenge is not technical, it is decision making, knowing when to operate, how far you can go, and how to balance safety with completeness of the surgery, and that defines the outcomes. So technology enhances the skill, but it does not replace the judgment of a surgeon. You have to understand. So technology நம்மள வந்து மேம்படுத்தலாம், ஆனா ஒண்ணே அது நம்மளோட judgment, doctor judgment replace பண்ணாது. So why is it we have to adapt? Now why is it so important to train doctors? Because one hospital or one system or one cannot treat the entire community. So we have to change the healthcare of this country. We have to train multiple doctors, and that is our first motto here, because we have proved that it is a very successful. World over, if you see 5 lakh hysterectomies, removal of uterus has been done across India, and 3 to 4 lakhs myomectomies, removal of fibroids have been done. So you can see the complexity of these cases. But all these women need to return back to their normal without complications, to reduce the complication rate. So if we truly want India to be globally placed, we must move from individual excellence to collective excellence. And that is the only way to impact, and that is the only way our impact can be scalable. So one thing I'd like to share, which was a very emotional moment, when a doctor patient of mine, when she came to me and she said, I was a topper, gold medalist, but I'm not able to make decisions or practice because I'm suffering from endometriosis. It is fogging my brain. Any decision of patient, I'm not able to treat that patient. Pain and normal activity, I cannot go for functions. We did this complex surgery, explaining to her the risks, outcomes and everything. And finally, the next day morning, when I went to say, okay, you're getting discharged within 18 hours, she told me, you know what, doctor? She hugged me and told my entire team, she said, I have no pain. She called me after 1 month. I got my first periods. I have no pain. So this is the outcome. Conventional surgeries with our eyes can be only, we have limitations. Okay, but in robotic, because of the 3D HD camera and the instrumentations and the angulations in which it moves, we can go into deeper planes and clear micro disease that the patient is suffering. Because even if you leave a little bit of this endometriotic tissue behind, or any tissue, diseased tissue, they can again recur and again lead to another surgeries. That's why these patients who had multiple surgeries have come to us. So that really touched me and my team. So basically, we have to realize we are just not doing surgery, we are giving people their lives back. The message I would like to give to women today, don't normalize your suffering, please. Don't underestimate your pain. If your pain is severe, heavy bleeding, infertility, these are things that you don't have to live with. This has a cure, this has a solution, solutions do exist. Advancement in care exists, and you deserve access to it, and we are here to treat it. Because every woman who walked into our clinic did not want a treatment. She was looking to get her life back, her normal life back. We are all blessed to have normal lives. Just think on the other aspect. They cannot do your normal activity, like getting up in the morning, getting the children ready, or even going to an office. So as doctors, it's just not our job. I think it's beyond job. It is our responsibility. So I would like to tell people here, sitting here, these 5, what is about robotic surgery which makes it better than conventional surgeries? The only, I would say, a few things. One is the best outcome, because you can't give that outcome with just your hands and your naked eye, or with laparoscopic instruments. We have a 40x magnification where we can see even less than a drop of blood, which you cannot see on the naked eye. Number 2, the instrumentation and the energy sources we are using is so safe. There is no lateral spread or very minimal lateral spread, where it does not affect the organs at all. And then coming over to blood loss, very less blood loss, accuracy, precision. துல்லியமா ஒரு சர்ஜரியை பண்றது தான் ரொம்ப முக்கியம். ஒரு சர்ஜரியை நம்ம பண்ணும்போது எவ்வளோ துல்லியமாக பண்ணுறோம், எவ்வளோ அது அந்த சர்ஜரியோட அவுட்கம் அந்த லேடிக்கு திருப்பி ஆப்ரேஷனுக்கே வரக்கூடாது, அந்த லேடிக்கு அந்த டிசீஸை க்யூர் பண்ணி அனுப்புறது, இதெல்லாம் நம்ம வெறும் with our handheld instruments we really can't give because we have limitations in that. With robotic we are free, we are like a bird, we have 2 more extra arms. A woman who can work with, I'm a surgeon, imagine I have 2 extra arms to work with, and that is a blessing. So this is definitely a revolution in healthcare. Let me tell you something, we all lived in an era, you know, our parents, not us, in an era where before we didn't have cell phones, and when cell phone came people said many people didn't buy, but now even in a small village every single person has a cell phone. That has revolutionized this technology revolutionized everything for us. Likewise, we have to adapt to this technology. This is not a new technology, it's been there for 20 years. But we've got the best system that is ever available in the world, which is the Darwin CXI, to give the best outcome to the patients. So what we have to tell you is, now can anybody live without a cell phone? No. Why? Because it connected us and we know the benefits of it. Likewise, we should know, and the decision making, knowledge, everything lies with the surgeon only. So I take this opportunity to thank everyone, and I'm really humbled that everybody were here. I thank the press, you know, with folded hands for coming to help us, you know, spread this awareness. Numbers kaga naanga sollala, in the 500 complex cases in 2 years changed the women's way of healthcare and how they deal with surgery. They don't have to be fearful, they can get back and walk. You will hear some of my patients talking after this, how they actually feel after, you know, they giving their experiences is much more than what I can speak for you. So thank you everyone, thank you press, thank you everyone.
We will do the laparoscopy surgery, but you made it an open cut, and I was quite got frightened by the open cut. In what way they are going to cut, horizontal or vertical, so much confusions I had. Finally, through some friends' recommendations, I came to know there is a doctor called Dr.Padmapriya. She is doing robotic surgery. I was okay, and then just 2 weeks back I came and met her. The same day I fixed my surgery date. Within a week she did all the surgery. They took care of my hemoglobin level, and they did the surgery. Immediately I was able to recover quickly. Within the next day I was able to walk, and just 11th March I did. Now I am sitting in front of you. Within a week I can walk, and I can do most of the household chores, daily activities. I'm really happy that I found Dr. Padmapriya, and I'm very thankful to this whole team, other doctors, urologist doctors, Taslima and other sisters, everybody. I'm really thanks to the whole surgery team. Thank you.
Yeah, just I want to introduce this. Yeah, please come. Please come. Indra, see, please don't make, I'll forget names. Beneath everybody. Sonali, warriors. We have the mic, we speak. They did the training, they did repeated training, they trained.